reasons as to why you might be asked to see a cardiologist may include symptoms you might be experiencing. And again, it's very important to speak to your general practitioner with any type of symptom that you have. But usually, cardiologists will typically see patients who have symptoms of chest pain is one of the most common symptoms we get to see. And reassuringly, unfortunately, most of the chest pain symptoms that patients have are not related to a heart issue. And that's very, very reassuring. It's perhaps one of the most rewarding parts of my job is to be able to reassure a patient and to say that the symptoms they have are not related to the heart. But no doubt, chest pain is one of the common symptoms, but there are several other symptoms, and that can include the heart racing or fluttering, what we call palpitations. There might be shortness of breath, or it might be reasons to further evaluate someone's blood pressure or cholesterol or diabetes. Again, they're the major risk factors that we deal with. In addition, smoking, a family history or genetic predisposition to developing a heart problem might then lead your general practitioner to refer you to a specialist to better understand what's going on and what are the best strategies to improve on your health. From my perspective, the key in managing any of my patients is to really understand what symptoms they are having and how the symptoms are impacting their life, because I think that is the critical way to work together with the patient to optimise their wellness overall. Some of the treatments that we have on offer include lifestyle changes, and I think that's critical for all patients who might have a cardiac condition. And that might include making some changes to the diet, cutting down things like salt, too many fatty foods, trying to lose some weight and improve exercise. It's one of the critical elements. But also there is an importance to focus on the role of medication. Medication has no doubt made significant changes in the way we manage patients with heart disease. These medications can be simple as something like aspirin, which you can buy now over the counter, which helps thin the blood. And there are then other prescription medications that we use to control blood pressure, to control cholesterol, to control diabetes. So there are several medications, but again, I'm one to believe that we try to minimise medication if at all possible. And that's what I like to do with all my patients, is to see how we can minimise the number of medications that they're taking, but to ensure that they are having the best possible protection for any adverse events in the future. Being referred to a cardiologist absolutely does not mean that you need to have invasive testing. And as I said, the majority of the patients that I see, I'm very, very pleased to say that we can reassure them and no need for any further testing. So there are some simple tests that can be done to rule out any major issues. And those simple tests can be something like an electrocardiogram or an ECG. And that test is where we put a few leads on the chest, and that measures the electrical conduction of the heart. And we're able to pick up on that, whether there are any abnormalities in the way that the heart is beating, and whether that warrants any further attention with other investigations. There are other tests like monitors that we can put on, both to monitor the heart rate for patients who might have symptoms of palpitations or the heart racing or fluttering, or that the heart might be going too slow and they might be getting lightheaded or dizzy. So this is a few leads on the chest that stay on for 24 hours and monitor the heart, continuously giving us information about how the heart rhythm is working and to ensure that there are no abnormalities there. One of the other simple tests that we have is an echocardiogram. And an echocardiogram, or echo for short, is a simple ultrasound scan with no radiation whatsoever. It takes about 20 or so minutes, and it gives us very, very useful information about how the heart is pumping, how the valves are working, and whether there's any impairment or any weakening in the heart muscle that warrants further treatment. There are other tests that might be necessary when you see a cardiologist, and one of those tests is what we call a stress test. Stress tests are a very good way to see how the heart behaves under some physical stress, while monitoring the heart to ensure that there are no features of anything to suggest a blockage or a narrowing in an artery. They're often simple tests that can be done within a matter of 30 minutes or so, and it often gives us a response immediately, supervised by a cardiologist. There are several other tests that have become available now to detect heart disease, and they can include CT scans or a calcium score. One of the common reasons why I get to see patients who come in with a bit of a family history of heart disease, or their cholesterol might be a little bit high, but there's no history of any symptoms, a calcium score may be useful for certain individuals to tell us whether there is any element of plaque or calcium that is built up around the arteries. That then dictates how aggressive we need to be with lowering the cholesterol if it indeed is elevated. Being a clinician, as a cardiologist, but also as an academic researcher, really allows me to be at the forefront of how we best manage patients with heart disease. I'm particularly excited about what opportunities lay ahead for our patients, but also in developments potentially to minimise progression or development of heart disease in the first place. And that's really where I think the excitement lies, namely in the advent of newer therapies, newer medications, but also using technologies to better monitor for complications that may arise into the future. So I'm very, very excited about where we are going with technology and the practice of medicine, but also motivated to continue on my research to better improve how we manage patients with heart complaints.